My name is Christine Mode, and I'm a national delegate representing Iowa's District 4. This year, the Democratic National Convention convenes in an unprecedented time in American history. Millions of people have lost their jobs and consequently their health care in the throes of a catastrophic public health crisis. The COVID-19 pandemic has killed over 161,000 Americans, and tens of thousands more are infected every day. Does a Democratic platform that neglects to include a universal single-payer healthcare system in the midst of a global pandemic rise to the occasion? No, it does not, and this is why. Some people say that Medicare for all would only be popular in California or New York, but that is not true. You simply need to look at the Iowa Democratic Party platform to see why. When it comes to healthcare, the 2018 state platform is clear. Iowa Democrats support comprehensive, universal, single-payer healthcare for all. But this is not a recent development. In 2016, our state platform similarly stated that we support a single-payer healthcare system. Is this just a Bernie Sanders thing? No. If we go back to our 2012 state platform, you'll find that we supported universal, single-payer, accessible healthcare, including dental, vision, hearing, non-traditional long-term care, and wellness and prevention efforts. Discovering that Iowa Democrats have supported universal single-payer healthcare for the past 10 years is surprising. In fact, 38 out of 57 delegations have platforms that include some form of single-payer healthcare. Yet, the amendment to the national platform was voted down by those who chose to ignore a majority of Americans who support Medicare for all. It is time that we hold our representatives accountable. As a self-employed musician, I've constantly had to worry about healthcare coverage since I was kicked off my parents' insurance when I turned 26. Last year, in a freak accident, I got a concussion and I needed to go to the ER. In my confused state, I tried to contact my insurance provider to see if the visit would be covered. No one should have to worry about the cost of healthcare in an emergency, especially in a pandemic. There's lots of talk in this country about how great it is to be your own boss, but what is left out of that conversation is healthcare. The cost of paying for insurance through the marketplace is expensive, and I've considered getting a job in order to have coverage. But what this pandemic has shown us is that it doesn't work to have healthcare tied to one's employer, and it is time that we guarantee healthcare as a right, not a privilege. In the 2020 call to the convention, it states, "All delegates to the National Convention pledge to a presidential candidate shall in all good conscience reflect the sentiments of those who elected them." As someone who is elected to represent the people of Iowa, I cannot in good conscience vote for a platform that does not include a universal single-payer healthcare system. I urge all of you to vote no on the platform until our constituents are properly represented.